Senator from Arkansas.
Thank you, Madam President. As a result of Obamacare, millions will be forced to use money that they would have used to pay rent, help their children attend college, or invest in a business. Instead, they're going to have to use that money to pay for higher premiums and skyrocketing deductibles. Here's one such example from Huntsville, Arkansas, which is in the congressional district which I used to represent when I was in the House. This constituent writes about how he and his family must have to take drastic steps to be able to afford the cost of Obamacare, not the least of which includes returning to work after retiring last year. The email reads, "I've never before contacted a senator until today. Sir, I am outraged about the Obamacare issue and the Affordable Care Act. Because of recent developments over the Affordable Health Care Act and the obvious problematic issues related to its operation, policy, and implementation, we are selling 2 of our vehicles to save money. This is due to the direct impact of this legislation and due to the broken promises of President Barack Obama that have been repeated over and over to us for 3 years. We are also canceling our cable TV in order to save about $1,500 per year. We are cutting back on internet and switching to save another $1,000 per year. We are Christmas shopping in January. Our purchase of a new vehicle is now delayed for another 3 years. Our planned vacation trips for 2014 and beyond are being pared back." This is the #1 issue that I'm hearing from Arkansans: the high cost and, in some cases, the unaffordable cost of Obamacare. And it's interesting as we hear other members of the Senate come and read the same types of emails, the same types of letters that they're getting. They all have the same theme. They're put in positions that are simply untenable. They simply don't have the money to afford the so-called new insurance that they needed, as their old insurance was dropped from them. Now, we need health care reform, but Obamacare certainly isn't the answer. We need to transition the employer-based private insurance market towards ones that allows for flexibility, choice, portability, and fairness. Let's allow small business owners to pull together to purchase group insurance, introduce portability into the market. These are things that we need to do and continue. Some of these things are actually in the Affordable Care Act. And yet the reality is we can do that without $1 trillion of increased taxes and rapidly, because of the way that the business community is responding, making us a nation of part-time employees. We need to allow individuals to purchase insurance across state lines. We need to expand health savings account and flexible savings accounts. These are free market reforms that would drive down costs. The problem that we had prior to introducing the Affordable Care Act was affordability. And what's happened is, instead of driving down cost, we've driven up cost dramatically because of the way that the bill was structured. We also need medical malpractice reform. I'm an optometrist by training, and I can tell you that there's people all over the country in the course of taking care of patients that have to do things that are above and beyond sometimes the things that they feel like they need to do in order to protect themselves. And as a result, there's no ifs, ands, or buts. That definitely drives cost. With that, I yield the floor.